1, 2, 3, 4.
Hi, I'm Craig Desjardins. I'm the Director of Strategy, Innovation, and Partnerships at the City of Kingston, and I'm here to tell you more about family physician recruitment and retention.
Hi there, welcome back to Tell Me More, the podcast that keeps getting those quarterly update letters from Healthcare Connect. I'm host Autumn Hume, and today I think I'll confess something right off the top. I don't have a family doctor. It's been almost 3 years, and when I moved from Northern Alberta to a city with a med school, I thought finding a new doctor would be, easier. I'm not alone, though. Lots of folks are getting by without a primary care physician or family physician, although it's far from ideal. So today, I've got Craig Desjardins in to talk about what the city is doing to help with this problem. The family doctor shortage is a result of several factors, and fixing it won't happen all at once, but Craig is going to help shed some light on what steps the city is taking to alleviate. Welcome back, Craig.
Great to be here, Autumn.
Yeah. I was wondering if you could just start by setting the table a little bit for us here. As someone working on this, what are you hearing about from family doctors? Why is this such a struggle to find and retain them? Could you tell me about what the situation's like right now?
So that's a great question. And maybe just to add to that broader context, I'll just give you a little bit of history.
Yeah, that's great.
Certainly the challenge is really around supply and demand. Supply of family doctors, but also demand in terms of patient demand.
Right.
And again, it's a perfect storm, if you will, with doctors. The city very proactively, and back pre-pandemic, spent the time to actually do a physician supply study. We took a look at, we heard from the province that we had all these family doctors and we shouldn't have a problem. We actually went out and actually talked to these doctors. And what we found was there are quite a few that work at Queen's that don't actually see patients. There's quite a few that work at OHIP and don't see patients.
Interesting.
We had quite a few that actually had already retired and are still on the rolls, but actually don't see patients. And when we started to look at that number, it was significantly lower than what the province had in their books. And we also saw some worrying trends, and those trends were not dissimilar to the demographics of our society, of our community. These doctors were aging, and the number that we're going to be retiring in the next 5 to 10 years was worrisome. And again, that's not dissimilar to the trades, electricians and plumbers. We have a lot of people that are at the point of retirement in the very near future.
Broad demographic issue right now.
Absolutely. So with that sort of supply issue, I would also throw in the supply issue around how doctors are actually paid and how they're organized. So how they work in clinics. The old model was very much a doctor had their own private medical practice. They employed people, they rented or bought a building. And of course, we've started to move to different models like the family health team,
Right, yeah.
Which are funded by the province, and the doctors are more employees. So we've seen a lot of change that has improved their quality of life. So they're not working, 18 hours a day, 7 days a week. They have a job and they do great work, but they also have work-life balance.
Very different being an owner-operator than just working for a place.
Entrepreneurship is absolutely one of the hardest jobs you can possibly have, and all more complex when we're doing something like family medicine.
Right, you pair those two together, that's an awful lot.
It's a challenge. So with that challenge, we entered the pandemic.
Right.
Obviously, a huge strain on our healthcare system and family physicians. And as we sort of emerged from that, again, that number that we'd identified of people who were unattached was around 29,000. That number, again, was challenging in that these doctors who hadn't retired during the pandemic, bless them, who they stayed and worked and served our community, started to say, I'm ready to retire. And we saw that again across the economy. So that's been a really big challenge, and we've had a significant number of doctors retire. But again, fortunately for us, we had the family physician recruitment and the initial investment by council of $2 million to recruit.
And that was when was that initial investment?
That initial came just at the tail end of 2021, and the actual effort started in 2022. I guess I'd also make a comment on the demand for services that we've seen. Kingston, and again, it's a story that's part of the economic growth story in our community. the last sort of 5-6 years, we've seen pretty strong growth in population.
Yes.
That's not something that we saw, sort of 10 years ago. And 10 years ago, we're seeing very low growth.
Not something we were expecting or planning for
Exactly.
either necessarily.
And it's something that the city's been planning for in other aspects that it controls,
Right.
infrastructure. But again, this is something that's provincially controlled, and they weren't planning for it. And, so the challenge is that we have a growing population with more demand. We have an aging population, and older citizens, older residents tend to consume more healthcare services than younger. So again, it's that the notion of a perfect storm when we had fewer doctors and more demand sort of collide together.
Well, and I'm really stuck on the structural challenge of, on paper, it says we have enough doctors, but in actuality, we don't have anywhere near that many because they're all off doing other things. They're not actually not all of them, but a chunk of them are not actively seeing patients, but they're still getting counted towards that.
Exactly. And again, the city, it's not our responsibility. It's a provincial responsibility.
Absolutely.
But, again, the Mayor Patterson has said it so eloquently. The well-being of our residents is our responsibility. The economic prosperity of our community is our responsibility.
And there are things you can do beyond just hiring doctors, as in.
Exactly, and the family physician recruitment effort certainly has delivered some great outcomes, but it's also about collaboration. And I don't want to come on here today and say that the city and our team is the reason for the success of this.
Right.
This has absolutely been a community collaboration, and it's really extraordinary to see the family doctors who are in our community. I won't say their names because I don't want to embarrass them when I say such nice things about them. But we're just so grateful. They have stepped up in so many ways, and it's the small things that you do not see. It's the collaboration between the Kingston Community Health Centre, Public Health, and Queen's University, creating the Well Babies program.
Right, yeah.
That helps make sure that the babies who don't have primary care providers get access to care. It's the doctors. They have a maternity wheel that doctors have agreed to be on, so they spin it when they find a pregnant woman and a future child that doesn't have a doctor, and that doctor takes them on. Again, that's another 400 new patients that have been cared for.
A lot of creative ideas.
This is about stepping up and solving our challenges in our community together.
Yep.
Again, the advisory committee that we've created to provide insights to the city on what we need to do in terms of attracting have just been amazing. Representatives from the Francophone community, representatives from the Chamber of Commerce, from clinics. The clinic managers. We've built a great partnership with those clinics to understand their needs and challenges, and work together. And the work between them. Again, these aren't competitive situations. These are collaborations between the different clinics.
Well, I think that would create a sort of two-way dialogue where we can better understand what doctors in coming to the community actually want and are looking for. We're not just stabbing around in the dark for incentives. We're
Absolutely
connecting with people, finding this is what you need to attract people. Let's help you get that.
And we have a natural advantage. So you mentioned earlier in your intro about you thought, well, hey, there's a medical school here, then what's the problem?
Easy.
That has been probably one of our best sources.
Makes sense.
We have had very significant success, and we are so grateful to the Queen's Family Medicine Program. We've been working with them on recruitment fairs. We've got a golf afternoon coming up for graduating residents. We have a cruise for incoming residents later this summer. Again, it's about making them aware of what amazing things are in Kingston. And one of the great advantages is that many of these students actually went to Queen's as undergrads. So they've been here a while. Some of them have done medical school here. And they're going to do residency. So many of them have spouses. They have kids that are in our school systems. They have a home. So we have an advantage, but you do have to ask people.
Yeah.
And you have to make sure they're aware of how important that we think they are. And that's been just amazing to see that relationship grow.
That's great because especially with a school like, especially with a school like that here, you would hope to see that people would come to school, learn, and want to stay in the city. Kingston is a pretty decent city. I mean, it seems like an appealing place to be.
We hear that all the time, and again, that's actually sort of the main sort of source. But just to give you residents a sense, we also focus on. We're very mindful not to. I don't say poach, I guess is the term.
Yeah.
Doctors from neighboring communities.
Yeah,
This
we're
is
all looking.
this is a very competitive space. We're actually very active outside of the province. So we're heavily into Quebec right now, doing a lot of campaigning there. British Columbia, and the other source is actually international. So the province, in a very positive move, has changed some of the certification regulations around foreign doctors, and it's I think it's most of the Commonwealth countries. So Britain and Australia. We just got an Australian doctor that's was originally Canadian, moved down there for 10 or 15 years and has come back. And it's just exactly, and we're very happy to have them. So they know what Canada's all about. They've got experience. And that notion that we're hiring practicing doctors, I know other communities have taken sort of different strategies. They've offered scholarships to medical students. Some of those students are 4 or 5 years out in terms of practicing. That's a long way.
Can happen in 5 years. For a young person.
People change their minds, but the need here in Kingston is now.
Yes.
It's not 5 years from now. So we've been very disciplined and very focused on making sure we hire physicians that are ready to practice as soon as they hit the ground.
Yeah, they show up in day 2. They're ready to start taking patients, basically.
Exactly.
Oh, that's great. Well, I did wonder, sort of. I mean, obviously, healthcare is a provincial responsibility, and so where does the City of Kingston fit into this? And what I'm starting to hear from your previous answers is collaboration with sort of healthcare groups, industries, maybe finding ways where we can finding gaps that the city can address within our jurisdiction, our mandate, and help support those efforts?
Absolutely. On a personal level, directly with the doctors, again, the city can sort of talk about what a great community it is and all of the infrastructure and amazing lifestyle. We have actually a relocation specialist that works with the doctor and their families to make sure they make sure they find the hockey league for their son or daughter, and that they know what's what in terms of arts and culture. But again, it's also connecting them with local doctors, because again, as nice as it is to talk to me, talking to a doctor who's practicing here tells you what they can expect, the reality of the day-to-day operation. And again, for doctors to step forward and take these young future doctors or soon-to-be Kingston doctors out for dinner or into their homes, like this is the kind of partnership that, again, is that's why we're landing doctors.
It's that mentorship, that welcome to the community. You're a part of it.
In terms of the sort of the programs, we did a lot of research. A lot of communities were amazing in sharing their ideas and their experience with us. The Family Physician Recruitment Funds, the $100,000 for a service agreement to come and practice. They get $20,000 a year for 5 years. That's been the backbone of that's sort of you have to have it to play in the space. That's every community does that.
Cash incentives are pretty standard.
It's critical. The new funds that council approved just this year, we actually took a slightly different tact, and I'm quite excited to see we're sort of right in the middle of it. We heard from doctors who were here and said, well, what about us? And they said, we think we can contribute. It wasn't like, hey, give me money. It was like, how can we help to solve this problem?
Right.
And the response was that, we'll work with anybody. You guys know your business. And we kept hearing over and over again how much time and effort these doctors were spending on paperwork. So they were spending so much doing all the ministerial, and of course we all know about paperwork.
It's a lot for a clinic,
it's a lot.
too.
So literally they were spending almost much or more time on paperwork than they were on seeing patients.
Yep.
So we said, well, how can we solve that? And they said, well, there's technology that you can introduce into your clinics that can improve efficiencies. But a lot of it was around increased staffing, adding,
like administrators?
nurse practitioners, physician assistants, scribes, administrators. Different clinics had different sort of ideas of how their clinics were set up and what the optimum proposal was. So we created this, family clinic grant.
And this is
program.
out of the money that was allocated in
That's correct.
December 2023?
That's correct. correct, yes. And again, we're excited. We received 7 grants. We're just in the process now of adjudicating those with an independent panel. And again, some amazing ideas, but basically they're committing to adding about 1,000 new patients to each of their clinics based on this investment by the city. So again, another different way focused. I think there's a great alignment with the city's focus on innovation. Certainly my focus, that's part of my job title. But exploring new and different ways to solve the problem. It's not just always about attracting, but how do we get more efficient, better at what we do.
We have to look external, but we also have to look internally, because we have people here, and what do we need to support them? It's that retention piece, right? Like,
absolutely.
We've brought you here, but how do we make sure you're going to be successful in this community? And that seems like a great idea. I got to ask about periwinkle. I've seen that around quite a bit. What is it?
So yeah, great, and I hear it often, and a lot of people have, they hear the name and they have no idea. This is really something that, again, speaking to the topic of innovation, this is a new model of care. It's an interdisciplinary model, so it has doctors and nurse practitioners working collaboratively to improve their efficiency, but also having other healthcare professional, allied health with them. And really, the periwinkle is if you think a periwinkle flower has 5 petals, the 5 petals represent different aspects of the aims of the clinic. So having more equity, better care, happier employees. Again, all of this is about interdisciplinary care and about having care closer to home. So you would have seen some in the media, this notion of a health home.
Yes.
And again, this is an effort that's really being driven by the Ontario Health team, who we're working incredibly closely with, to make sure that people have care close. So you don't have to drive 60 minutes, 40 minutes to get care, that you have care in your backyard. It's like a 15-minute drive to where your primary care, your physician is. So
that's incredible.
Kingston's been divided into different zones. Some of them have the zones, some of them are just being set up, and the periwinkle is sort of in the center of the city. And from what I hear, that should be up and going this coming late summer, early fall. And we're talking about 8,000 to 10,000 patients that will be registered there. So this will be a game changer.
That's incredible. 8,000 to 10,000.
8,000 to 10,000. When you combine that with the sort of 5,000 to 6,000 we're looking at from the clinic grant,
right?
We've already been really taking a great crack at reducing that Healthcare Connect list and connecting people. And you're going to see some really great progress, and we're so pleased with that.
With the inventory you were talking earlier, like sort of a 20 to 30,000 gap, and bringing in 10 to 16,000, that's like it's having it almost.
It's pretty
assuming
close.
the numbers have stayed roughly the same.
Yeah, we're very very excited about that, and that actually is a great reason to bring up Healthcare Connect.
I was going to say, so periwinkle, how do I get into this?
That's right. Well, again, rostering. I can't tell you how. I'm sure the public was very demoralized to see the pictures from the spring of people lining up, for hours on hours, the cold, seniors, just horrible. But that, again, is a sign of the need and the desperation. Rostering and connecting people is more than just giving your name. It's the clinic needs to have your files and your records. You have to agree. So again, understanding that is not the model we want, where it's whoever can line up the longest or come in the earliest to stand in line. Using Healthcare Connect is the model that we're using. We've worked with the clinics in the community to move to that, and it's about getting registered. And I know I hear some people have been on it for quite some time. We are finally getting people off of that list and into rostered family physicians, but you need to get on that list if you can, and we encourage you to do that. We're encouraging the clinics to get rid of their private lists, so those are gone now. So it's getting them onto that list. The challenge, and that's something we're working on with the OHT in the province, is that they can only roster so many people through Healthcare Connect every week.
Right.
I think it's about 200. So they need more capacity, because all of a sudden, that's the big worry I have now. That what keeps me up at night is that when Periwinkle does get ready to launch and they have to roster 8,000
at 200 per week,
it's that's the bottleneck right now. So we're working on beyond that, I think you're going to start to see people be rostered very, very soon. Health Connect is going to be reaching out and saying, hey, you're going to be at this clinic. We have been working on the recruitment of the 4 doctors so those will be 4 we announce probably midsummer. We've got 2, 3. I don't want to say any names yet, but we're getting close on making sure we have those doctors lined up. So
That's awesome.
Again, it's great, but again, if you're not on Healthcare Connect, get on Healthcare Connect, register. It's very easy. You can Google it. If you have a challenge, reach out to the city. We've got it on our social media platforms. I believe we had some great communication that's gone out recently. It's super easy, phone or try the internet.
Yeah, and I know for many on that program, they would constantly get the updates saying you're still on it, but there's been no progress, and there's no more information that comes from that. Sitting in a vacuum year over year, getting that can be demoralizing, but knowing that there's some motion at the front of the line, that's inspiring.
That's really critical. And again, like one of the things that we sort of were chatting recently with Healthcare Connect, and if your phone number has changed, phone them and let them know.
Right.
If your address has changed, if you got a doctor, like sometimes people have got doctors. I don't want to again say anything bad about the provincial healthcare system, but I'm not sure whether their IT systems all speak to one another. So sometimes people can have a doctor and they're still on the list. So again, I think you're seeing more collaboration, the need for more collaboration. You're seeing better communications across these organizations.
Okay, so I just wanted to jump into, you've touched on a bunch of these programs now, but I just wanted to jump on into some of them and see if there's more we can talk about, or we'll blow through them here a little bit. So let's start with the Recruitment Incentive Program. This is the money that you were talking about 5 years ago. What's come out of that?
So again, it's been incredible. This is basically the Physician Recruitment Incentive Program. It's $100,000. It's $20,000 a year over 5 years. The family physician basically commits to staying here and rostering a specific number. It's about 1,250. If you're a brand new doctor just out of residency, we give you a couple of years to sort of work so we don't want to swap the docs, the new doctors, the young doctors. So we give them a chance to sort of build up their roster.
It's a great idea.
Which has proved to be very successful. And again, that's the core reason why we've secured the doctors that we have.
Do you have an idea of how many that has sort of...
So in total, we're at 17.
17.
So we had 9 announced last year and 8 that we just recently announced. And as I said, we've got another sort of 4-ish that we're working on right now. So again, amazing efforts. I've got an amazing person, Diana, who I think you've interviewed in the past.
We've had Diana on.
I think on Workforce. It's tied to Workforce. That's sort of why my group oversees it.
More of those things peter out.
And again, to see these doctors enjoying the community, because again, we're very mindful about their experience. So we've been doing follow-up. We did a follow-up survey, an interview with those first 10 doctors that we got, and sort of said, hey, how are you doing? What did we do right? What didn't we give you that you needed?
Use that data to tweak
exactly,
the approach
and tweak the program. The clinic grant sort of that I referred to earlier. Some of that sort of came out about the frustration that doctors are having with the amount of paperwork.
Yeah. So
that sort of led to the growth of that program, and exciting to see it finally launch.
And going to the clinic grant, which we talked about a bit earlier, how many... I want to throw some numbers again to that. How many clinics have we seen sort of jump on board with that?
So we've received 7 applications.
Wow. Okay.
So it's a grant of up to $100,000.
Yep.
And the agreement that'll be in place. So basically, their commitment is to add 1,000 new residents to their rosters. So again, that's really exciting to see. Again, when we're in talking to the doctors, and again, we all know paperwork in our own businesses, but it's onerous.
It is, yeah.
It is significant, and anything we can do and again, we talked to some other doctors who actually are specialists, and they've described how having a scribe, having somebody that actually, instead of the doctor writing down or typing in notes into the computer, the scribe is doing that, and the doctor just says, order these tests, and it's seamless and incredibly efficient, and great to see that.
There's one program that I saw that was it was like an AI generated note taking program where the doctor barely had to type anything, and it kept going, and I didn't see them afterwards, but I assume they were accurate enough because the doctor did like a nice review afterwards, make sure it all checked out, and then submitted them.
Well, it's really complex. There's actually a company in Kingston that actually has a software that converts. So when a doctor provides services, there are different codes, like again, like
Right, the
everything,
billing codes
the
and
billing
whatnot.
codes, and
Heard of
you know, instead of having to sort of guess at it, some of the software automatically assigns the code. So again, how do we save time? Scheduling. You know, it's you
I
know
want
having.
my doctor worried about symptom evaluation, not whether they're filling out a form correctly, right?
There's a couple of really fascinating software scheduling. It's sort of like Doodle. Some people might be familiar with that, but again, this kind of moving the doctor's practice into the 21st century is something that again gets them seeing patients, which is what we want, not filling out paperwork.
That's fantastic. And yeah, on the Queen's engagement, what's that resulted in? Obviously, we've had these great activities, this great sort of community engagement.
Yeah, the Queen's relationship really is, as I said, is the foundation. It's where we've seen the most success in recruitment. Partly, as I said earlier, about the fact that they've lived here, they know how amazing our community is. But again, having that incentive, medical school is very expensive. They've been in school for some of them 10, 12 years. So having that incentive as part of the package is just extraordinary. We did a session. It was late last year with the class of third year residents, second year residents, about what it's like to have a practice. So we had again our local doctors come in and say, this is how, like, very candid, like, this is how much I make.
Yeah.
this is how much I have to pay out in other expenses, and this is the reality. Like that kind of honest, candid. Again, it's not sunshine and rainbows every day. We all have the hard part of our jobs, but again, that kind of honesty and insight is paying off for us.
Well, I don't have anything else to ask about. Did you want to expand on anything else?
You know what? The last thing, and again, this is a great opportunity for a call to action.
Yeah.
So if I can ask, it's great that you've asked me questions. Maybe just ask of our listeners, the residents. I mentioned earlier about registering with Healthcare Connect.
Yes.
So please, if you haven't, register. We're about to pull several thousand, tens of thousand people off that list, so we need you to register. The other thing, and it's interesting that we've had some success with local residents giving us leads. So this is like a family member, maybe
Really?
a child or a nephew or somebody who maybe grew up in this area and practices another part of the country. If you think you've been, we've had several that are parents that want to have their kids come back to the area. The aging parents, the kids I think want to come back and make sure that their parents are okay.
Everybody benefits.
If you have a lead, let us know. We've had 2 or 3 that have been successful in that with that recruitment model. So we're happy to take whatever referrals we can get. And lastly, we've been working really hard on figuring out how we can get business owners involved. I hear when we're out talking to business owners, how can we help? Or my employees are facing this challenge. There are opportunities for sponsorship. I mentioned the golf afternoon we have. The Cataraqui Golf and Country Club. What an incredible partner working with us to see how we can again demonstrate the kind of lifestyle outside of the hospital or outside of the doctor's office. What amazing things we have to offer. But yeah, if there are organizations out there that want to sponsor. That want to talk to us about creative ways to sort of get their names out as leaders, and then this matter is important to them, we would be very interested in talking.
Sounds like a great way to both help the process and also get your name and your business in front of a bunch of doctors that are coming into the community.
Absolutely,
Seems
absolutely.
beneficial. Well, thanks so much for joining me today, Craig. I learned a lot. And thank you, everyone, for joining us who listened. And if you're like me and searching for a doctor, please make sure you're on Healthcare Connect. There's no time like the present. If you know anybody that might be looking to start their practice or get started or is a doctor but looking for a change of pace, let them know what the Limestone City has to offer, which is a lot. And yeah, if you're a local business looking for a way to get your name out there, looking to connect with new incoming doctors and contribute to something really positive in the city, there's some sponsorship opportunities for you. And if you're just looking to learn more about what the City of Kingston does, you can find our past episodes wherever you get podcasts, likely wherever you're listening to this one now. If you want to connect with us, find the city on social media or email us at podcasts@cityofkingston.ca with any episode ideas, thoughts, whatever. And we're always happy to hear from you. And until next month, stay well. Thanks, everybody.